Trauma Surgery, Questions and Answers, offers an unmatched guide to trauma care. Dr. Atef Ahmed draws from extensive experience to address real-life scenarios through evidence-based insights. The book covers the full spectrum of trauma surgery, from pre-hospital care to interventions and rehabilitation. It serves students, residents, fellows, and experienced surgeons. Questions mirror complex challenges faced in practice. Answers combine clinical expertise, research, and best practices for practical solutions. Beyond an educational resource, the book provides mentorship in critical thinking and compassionate care. Its reader-centric approach empowers confidence in navigating trauma surgery. It honors the rapid decision-making and dedication of unsung heroes who uplift and restore hope when it's needed most. This is an indispensable journey into the world of trauma surgery. Master knowledge, skills, and artistry to pursue excellence in patient care. The book contains 2050 professional questions and answers in all aspects of trauma. No book in the market contain this number of questions in this professional style. Get your copy now at Amazon and for low price. With best wishes of the author, Dr. Atef Ahmed.
Question. Discuss the significance of the seatbelt sign in trauma assessment. Answer. The seatbelt sign refers to a contusion or abrasion pattern across the abdomen or chest caused by a seatbelt during a motor vehicle collision. It may indicate underlying intra-abdominal or thoracic injuries, even in the absence of external signs. Patients with a seatbelt sign should be thoroughly evaluated for internal injuries. Question. Describe the approach to managing a patient with a suspected spinal cord injury. Answer. In suspected spinal cord injury, the cervical spine must be immobilized using a cervical collar or sandbags. Assessment should follow the ABCs, and neurologic examination should include assessment of motor and sensory function. Imaging studies like CORT or MRI are crucial for identifying spinal cord injuries and guiding management. Question. What is the significance of a Battles sign in head trauma assessment? Answer. Battles sign refers to ecchymosis over the mastoid process and is indicative of a basilar skull fracture. It can be a sign of significant head trauma and potential intracranial injury, requiring thorough evaluation and imaging to assess for complications like cerebrospinal fluid leakage or brain hemorrhage. Question. Discuss the management of a patient with suspected aortic injury following blunt trauma. Answer. In a patient with suspected aortic injury after blunt trauma, a high index of suspicion is crucial. Initial stabilization involves blood pressure control to reduce the risk of aortic rupture. CORT angiography or transesophageal echocardiography is used to confirm the diagnosis. Definitive management may involve endovascular repair or open surgical intervention.
Question. What is the role of permissive hypotension in managing hemorrhagic shock? Answer. Permissive hypotension involves maintaining lower blood pressure than usual in patients with hemorrhagic shock to prevent further bleeding. This approach aims to avoid increasing blood flow to injured vessels, reducing the risk of worsening hemorrhage. Fluid resuscitation is limited until bleeding is controlled surgically. Question. Describe the steps for managing an inhalation injury in a burn trauma patient. Answer. In managing an inhalation injury in a burn patient, airway management is of utmost importance. Early intubation or bronchoscopy may be necessary to assess airway patency and rule out upper airway obstruction. High-flow oxygen should be administered, and the patient should be closely monitored for signs of respiratory distress. Question. What is the significance of Cushing's reflex in traumatic brain injury? Answer. Cushing's reflex, characterized by hypertension, bradycardia, and irregular respirations, is a sign of increased intracranial pressure in traumatic brain injury. It indicates brainstem compression and impending herniation, requiring urgent neurosurgical intervention to relieve pressure. Question. Explain the principles of permissive hypercapnia in mechanically ventilated trauma patients. Answer. Permissive hypercapnia involves allowing a slightly elevated carbon dioxide (CO2) level in mechanically ventilated trauma patients with lung injury. This approach helps minimize the risk of ventilator-induced lung injury by using lower tidal volumes and reducing alveolar strain.
Question. Discuss the indications for emergent thoracotomy in trauma patients. Answer. Emergent thoracotomy is indicated in trauma patients with signs of life, pulse or signs of perfusion, who deteriorate despite resuscitative efforts. It allows for direct access to the heart and great vessels, enabling internal cardiac massage, control of massive bleeding, and repair of cardiac injuries. Question: what is the role of a diagnostic peritoneal lavage (DPL) in trauma assessment? Answer: diagnostic peritoneal lavage (DPL) is a technique used to assess for intraperitoneal bleeding or visceral injury in trauma patients who are unstable for a CT scan. It involves introducing saline into the peritoneal cavity and analyzing the returned fluid for the presence of blood. Question: describe the differences between a type 1 and a type 2 odontoid fracture. Answer: a type 1 odontoid fracture involves a fracture at the tip of the odontoid process. A type 2 fracture occurs at the base of the odontoid process and is the most common fracture pattern. Type 2 fractures are more unstable and have a higher risk of non-union, necessitating surgical intervention. Question: explain the role of amniotic fluid embolism in maternal trauma. Answer: amniotic fluid embolism is a rare but life-threatening complication of maternal trauma or labor. Amniotic fluid enters the maternal circulation, triggering an acute allergic-like reaction and disseminated intravascular coagulation (DIC). Rapid intervention, including resuscitation, blood product administration, and supportive care, is essential.
Question: discuss the role of damage control laparotomy in trauma surgery. Answer: damage control laparotomy involves performing only essential surgical procedures to control hemorrhage and contamination in critically ill trauma patients. The abdomen is temporarily left open, and definitive repair is delayed until the patient's condition stabilizes. Question: explain the purpose of using an external fixator in managing open fractures. Answer: an external fixator is used to stabilize open fractures, particularly in cases of complex fractures or soft tissue injuries. It provides temporary stability, facilitates wound care, and allows for definitive fracture management once swelling and soft tissue conditions improve. Question: what are the indications for using an intra-aortic balloon pump (IABP) in trauma patients? Answer: intra-aortic balloon pump (IABP) is used in trauma patients with severe cardiac dysfunction or shock. It provides hemodynamic support by augmenting diastolic pressure and improving coronary perfusion, reducing myocardial workload. Question: describe the treatment approach for a patient with a pelvic fracture and hemodynamic stability. Answer: in a patient with a pelvic fracture and hemodynamic stability, treatment involves pain management, careful monitoring, and consultation with orthopedic and interventional radiology teams. Immediate pelvic stabilization may be considered if there's evidence of ongoing bleeding or significant pain.
Question: discuss the management of a patient with a traumatic amputation. Answer: in managing a traumatic amputation, the residual limb should be wrapped in a sterile dressing and elevated to control bleeding. The amputated part should be kept cool and transported with the patient for possible reattachment. Tetanus prophylaxis, pain management, and psychosocial support are also essential. Question: what is the role of damage control orthopedics in trauma surgery? Answer: damage control orthopedics involves temporary stabilization of long bone fractures in critically ill trauma patients. This approach reduces the risk of complications, such as fat embolism and excessive blood loss, and allows for definitive fracture fixation at a later stage. Question: explain the management approach for a patient with a gunshot wound to the abdomen. Answer: management of a gunshot wound to the abdomen includes emergent surgical exploration. Intravenous fluids and blood products are administered to maintain blood pressure. Intraoperative findings will dictate the need for bowel resection, repair of hollow viscous injuries, and control of bleeding. Question: discuss the indications and technique for using a vacuum-assisted closure (VAC) device in wound management. Answer: a vacuum-assisted closure (VAC) device is used for wound management, particularly in complex or contaminated wounds. It creates negative pressure that promotes wound healing by enhancing blood flow, reducing edema, and promoting granulation tissue formation. Question: what is the purpose of using an Asherman chest seal in managing an open chest injury? Answer: an Asherman chest seal is used to cover open chest injuries and create an airtight seal. It prevents air from entering the pleural cavity and causing a tension pneumothorax, allowing the lung to expand normally during inhalation.
Question: describe the steps for managing a patient with suspected vascular injury due to a penetrating trauma. Answer: in a patient with suspected vascular injury from penetrating trauma, immediate assessment and control of bleeding are crucial. Direct pressure is applied to the bleeding site, and a tourniquet may be used if necessary. Hemorrhage control is followed by surgical exploration and repair of the injured vessel. Question: explain the role of high-frequency percussive ventilation, HFPV, in managing traumatic lung injuries. Answer: high-frequency percussive ventilation, HFPV, is used in traumatic lung injuries to provide lung recruitment and oxygenation. It delivers small, rapid breaths at high frequencies to improve oxygen exchange and maintain lung function in patients with compromised respiratory status. Question: what is the purpose of using a pneumatic anti-shock garment, PASG, in trauma patients? Answer: a pneumatic anti-shock garment, PASG, also known as a military anti-shock trousers, MAST, is used to provide temporary stabilization and increase peripheral vascular resistance in trauma patients with hypertension. It helps redistribute blood from the extremities to vital organs, improving perfusion. Question: discuss the role of a tourniquet in controlling bleeding from extremity injuries. Answer: a tourniquet is used to control life-threatening bleeding from extremity injuries that cannot be controlled by direct pressure. It is applied proximal to the injury site and tightened until bleeding stops. Tourniquet use should be limited to cases of severe hemorrhage to avoid complications. Question: explain the purpose of using recombinant factor VIA, RFVIA, in trauma patients. Answer: recombinant factor VIA, RFVIA, is used in trauma patients with severe bleeding, refractory to conventional hemostatic measures. It promotes clot formation by bypassing the need for certain coagulation factors, aiding in the control of hemorrhage.
Question: explain the purpose of using recombinant factor 7A, RF7A, in trauma patients. Answer: recombinant factor VIIA, RFV2A, is used in trauma patients with severe bleeding, refractory to conventional hemostatic measures. It promotes clot formation by bypassing the need for certain coagulation factors, aiding in the control of hemorrhage. Question: describe the management of a patient with suspected cardiac tamponade. Answer: in a patient with suspected cardiac tamponade, pericardiocentesis is performed. A needle or catheter is inserted into the pericardial space to drain accumulated fluid, relieving pressure on the heart and restoring cardiac function. Question: discuss the indications and technique for using an escharotomy in burn injury management. Answer: an escharotomy is indicated in full-thickness circumferential burns that cause vascular compromise due to constricting eschar. It involves making incisions through the burn eschar to relieve pressure and restore blood flow. This procedure prevents compartment syndrome and improves perfusion. Question: what is the role of a left thoracotomy in managing cardiac injuries? Answer: a left thoracotomy provides direct access to the heart and great vessels, allowing for repair of cardiac injuries, control of bleeding, and internal cardiac massage. It is indicated in patients with penetrating chest trauma and cardiac instability. Question: explain the concept of iatrogenic trauma and its implications. Answer: iatrogenic trauma refers to injuries or complications that result from medical interventions. In the context of trauma, it could involve complications from procedures or interventions aimed at managing trauma. Minimizing iatrogenic trauma is crucial to ensure optimal patient outcomes.
Question: describe the management of a patient with a suspected basilar skull fracture. Answer: in a patient with a suspected basilar skull fracture, strict neurological observation and frequent neurologic assessments are necessary. Imaging studies, such as CT or MRI, are used to confirm the fracture. Close monitoring for signs of intracranial hypertension, cerebrospinal fluid leakage, and other complications is essential. Question. Discuss the indications and complications of using a nasogastric (ING) tube in trauma patients. Answer. A nasogastric (ING) tube is indicated in trauma patients with suspected abdominal injuries or who require decompression of the stomach to prevent aspiration. Complications can include nasal mucosal injury, tube misplacement, and increased intracranial pressure in patients with traumatic brain injuries. Question. Explain the purpose of using hypertonic saline in traumatic brain injury management. Answer. Hypertonic saline is used in traumatic brain injury to reduce intracranial pressure by drawing fluid from brain tissue into the bloodstream. It helps maintain cerebral perfusion and can be administered as an osmotic agent to control elevated intracranial pressure. Question. What is the significance of modeling in trauma patients and its implications? Answer. Modeling refers to patchy skin discoloration caused by poor peripheral perfusion in trauma patients. It indicates compromised tissue oxygenation and perfusion and may signal shock or severe hypoperfusion. Identifying modeling prompts the need for aggressive resuscitation and intervention.
Question. Discuss the role of damage control resuscitation in managing trauma patients. Answer. Damage control resuscitation focuses on the early control of bleeding and balanced resuscitation with blood products, including red blood cells, plasma, and platelets. This approach aims to prevent dilutional coagulopathy and reduce the risk of complications from massive transfusion. Question. Describe the management of a patient with suspected acute traumatic coagulopathy. Answer. In a patient with suspected acute traumatic coagulopathy, rapid blood product administration is essential to correct clotting dysfunction. Fresh frozen plasma and platelets are administered to address clotting factor deficiencies and improve hemostasis. Addressing the underlying cause of coagulopathy, such as hypothermia or acidosis, is also important. Question. Explain the concept of heparin rebound and its implications in trauma patients. Answer. Heparin rebound refers to the transient hypercoagulable state that can occur after discontinuation of heparin therapy. In trauma patients, it can contribute to increased risk of thromboembolic events. Transitioning to other anticoagulants and vigilant monitoring are essential to prevent complications. Question. Discuss the use of damage control thoracotomy in trauma surgery. Answer. Damage control thoracotomy involves performing limited surgical procedures to control bleeding and achieve hemostasis in critically ill trauma patients with chest injuries. It may include control of lung or vascular injuries and is often followed by staged definitive repair once the patient's condition is stabilized.
Question. Describe the approach to managing a patient with suspected retroperitoneal hematoma. Answer. In a patient with suspected retroperitoneal hematoma, hemodynamic stability is paramount. CT imaging is used to confirm the diagnosis and assess the extent of bleeding. Interventional radiology procedures or surgical exploration may be required to control bleeding and repair injured vessels. Question. Explain the role of hypertonic saline in fluid resuscitation for trauma patients. Answer. Hypertonic saline is used in fluid resuscitation to expand intravascular volume and increase mean arterial pressure. It also helps draw fluid from interstitial spaces, reducing edema. Careful monitoring of electrolytes and osmolarity is necessary to prevent complications. Question. Discuss the indications and complications of using an epidural catheter in trauma patients. Answer. An epidural catheter can be used for pain management in trauma patients with multiple rib fractures or other injuries. Complications may include infection, catheter displacement, and risk of epidural hematoma or abscess formation. Question. What is the purpose of using a rapid sequence intubation (RSI) approach in trauma patients? Answer. Rapid sequence intubation (RSI) is used to secure the airway in trauma patients who require emergent intubation. It involves administering sedative and paralytic agents in rapid succession to achieve optimal intubating conditions and minimize the risk of aspiration. Question. Describe the management of a patient with a suspected cardiac contusion. Answer. In a patient with a suspected cardiac contusion, close monitoring of vital signs and cardiac enzymes is essential. Echocardiography and ECG may help assess cardiac function and rule out significant injuries. Bed rest, pain management, and avoidance of inotropes are important to prevent exacerbation of myocardial injury.
Question. Explain the role of pelvic angiography and embolization in managing pelvic fractures. Answer. Pelvic angiography and embolization are used to control bleeding in unstable pelvic fractures with significant hemorrhage. Angiography identifies the bleeding source, and embolization involves blocking the vessel using coils or other materials. This technique helps stabilize the patient and avoid the need for extensive surgery. Question: discuss the management of a patient with a suspected spinal cord injury and neurological deficit. Answer: in a patient with a suspected spinal cord injury and neurological deficit, immediate immobilization and cervical spine protection are essential. A thorough neurological assessment and imaging studies, CT or MRI, are performed to determine the extent of injury. High-dose methylprednisolone may be considered within the appropriate time window. Question: what is the purpose of using reverse Trendelenburg positioning in trauma patients? Answer: reverse Trendelenburg positioning involves elevating the head of the bed to enhance venous return and reduce intracranial pressure in trauma patients with head injuries. This positioning promotes cerebral perfusion and helps manage intracranial hypertension. Question: describe the management approach for a patient with suspected inhalation injury due to burn trauma. Answer: in a patient with suspected inhalation injury, airway management and oxygenation are priorities. Intubation and mechanical ventilation may be necessary to maintain airway patency. Early bronchoscopy is performed to assess airway injury, and aggressive pulmonary care is provided to prevent complications. Question: explain the concept of compartment syndrome and its implications in trauma. Answer: compartment syndrome occurs when increased pressure within a muscle compartment compromises blood flow and nerve function. It can lead to tissue ischemia and irreversible damage. Rapid diagnosis and fasciotomy are necessary.
Question: discuss the management of a patient with suspected blunt cardiac injury. Answer: in a patient with suspected blunt cardiac injury, continuous cardiac monitoring and serial cardiac enzyme measurements are essential. Echocardiography can help assess cardiac function. Supportive care, pain management, and avoidance of excessive inotropes are important to prevent exacerbation of cardiac injury. Question: what is the purpose of using hyperbaric oxygen therapy in trauma patients with severe crush injuries? Answer: hyperbaric oxygen therapy involves administering oxygen at higher atmospheric pressure, which enhances oxygen delivery to tissues. It is used in trauma patients with severe crush injuries to improve tissue oxygenation, promote wound healing, and reduce the risk of complications like gas gangrene. Question: describe the management of a patient with suspected blunt aortic injury. Answer: in a patient with suspected blunt aortic injury, close hemodynamic monitoring and imaging studies are performed. CT angiography is often used to confirm the diagnosis. Definitive management involves surgical repair or endovascular stent grafting, depending on the specific injury and patient condition. Question: explain the purpose of using a cervical spine collar in trauma patients. Answer: a cervical spine collar is used to immobilize the cervical spine and prevent movement in patients with suspected or confirmed cervical spine injuries. It helps prevent further spinal cord damage during transfer and imaging studies. Question: discuss the management of a patient with suspected traumatic diaphragmatic rupture. Answer: in a patient with suspected traumatic diaphragmatic rupture, careful assessment of clinical signs and imaging studies, such as CT, is necessary for diagnosis. Surgical repair of the diaphragmatic defect is typically required to prevent herniation of abdominal contents into the chest cavity.
Question: what is the significance of fecal occult blood in trauma patients? Answer: the presence of fecal occult blood in trauma patients can indicate potential gastrointestinal bleeding or injury. Hemodynamic stability and close monitoring of vital signs are essential, and early consultation with surgical or gastroenterology teams may be necessary. Question: describe the management of a patient with suspected pneumothorax and respiratory distress. Answer: in a patient with suspected pneumothorax and respiratory distress, immediate needle decompression or chest tube insertion is indicated to relieve pressure and restore lung expansion. Administration of supplemental oxygen, pain management, and appropriate imaging studies are also essential. Question: explain the role of high-frequency oscillatory ventilation (HFOV) in managing acute respiratory distress syndrome (ARDS) in trauma patients. Answer: high-frequency oscillatory ventilation (HFOV) is used in trauma patients with severe ARDS to provide gentle lung ventilation and prevent alveolar damage. It involves rapid small volume breaths at high frequencies to improve oxygenation and lung compliance. Question. Discuss the management of a patient with suspected pericardial tamponade. Answer. In a patient with suspected pericardial tamponade, emergent pericardiocentesis is performed to drain accumulated fluid from the pericardial sac. This procedure helps relieve pressure on the heart and improves cardiac function. Surgery may be required for definitive repair of the underlying cause. Question. What is the role of a selective D-dimer assay in trauma patients with suspected deep vein thrombosis, DVT? Answer. A selective D-dimer assay is used to assess for the presence of clinically relevant deep vein thrombosis, DVT, in trauma patients. It provides a more accurate evaluation, reducing false positives, and helps guide further imaging studies or anticoagulant therapy.
Question. Describe the management approach for a patient with suspected traumatic hyphema. Answer. In a patient with suspected traumatic hyphema, bleeding within the anterior chamber of the eye protection and elevation are crucial to prevent further damage. Rest, pain management, and avoidance of activities that increase intraocular pressure are essential for preventing complications. Question. Discuss the management of a patient with a suspected traumatic hemothorax. Answer. In a patient with a suspected traumatic hemothorax, initial management involves chest tube insertion to evacuate blood from the pleural space and restore lung expansion. Hemodynamic stabilization, monitoring, and serial imaging are necessary to assess bleeding and prevent complications. Question. Explain the role of near-infrared spectroscopy, NIRS, in trauma patients. Answer. Near-infrared spectroscopy, NIRS, is used in trauma patients to monitor tissue oxygenation and perfusion non-invasively. It can provide real-time data on tissue oxygen saturation, helping guide resuscitation efforts and assess the adequacy of perfusion. Question. Describe the management of a patient with a suspected traumatic pneumothorax. Answer. In a patient with a suspected traumatic pneumothorax, chest tube insertion is indicated to remove air from the pleural space and allow the lung to re-expand. Continuous monitoring of lung sounds, imaging studies, and patient comfort are important during management. Question. Discuss the indications and technique for using a Swan-Ganz catheter in trauma patients. Answer. A Swan-Ganz catheter is used in trauma patients with hemodynamic instability to monitor cardiac output, pulmonary artery pressures, and central venous pressures. It is inserted via a large vein and advanced into the pulmonary artery to provide detailed hemodynamic measurements.
Question. What is the role of positron emission tomography, PET, in trauma patients? Answer. Positron emission tomography, PET, can be used in trauma patients to assess metabolic activity and cellular function in various tissues. It is particularly valuable for evaluating traumatic brain injury, tracking brain glucose metabolism, and detecting subtle changes in neural activity. Question. Describe the management approach for a patient with suspected traumatic diaphragmatic injury. Answer. In a patient with suspected traumatic diaphragmatic injury, close observation and imaging studies, such as CT, are essential to confirm the diagnosis. Surgical repair is usually required to prevent herniation and restore normal diaphragmatic function. Question. Explain the role of telemedicine in trauma care. Answer. Telemedicine in trauma care allows remote consultation and assessment of trauma patients by specialists. It can help guide initial management, facilitate decision-making, and assist with transfer decisions for patients in remote locations or underserved areas. Question. Discuss the indications and technique for using an orogastric tube in trauma patients. Answer. An orogastric tube is used in trauma patients to decompress the stomach and prevent aspiration in cases of gastrointestinal obstruction or ileus. It is inserted through the mouth and advanced into the stomach. Question. What is the purpose of using an arterial line in trauma patients? Answer. An arterial line is used in trauma patients to continuously monitor blood pressure and obtain arterial blood samples for analysis. It provides real-time information on blood pressure trends and helps guide resuscitation efforts.
Question. Describe the management of a patient with a suspected traumatic renal injury. Answer. In a patient with a suspected traumatic renal injury, Imaging studies such as CT scan or ultrasound are performed to assess the extent of injury. Non-operative management is often favored for stable patients with minor injuries, while surgical intervention may be required for severe injuries or hemodynamic instability. Question: explain the concept of triad of death in trauma and its prevention. Answer: the triad of death in trauma refers to the combination of hypothermia, coagulopathy, and acidosis that can lead to mortality. Prevention involves maintaining normothermia, addressing coagulation disorders promptly, and correcting metabolic acidosis to improve patient outcomes. Question: discuss the management of a patient with suspected traumatic tracheobronchial injury. Answer: in a patient with suspected traumatic tracheobronchial injury, flexible bronchoscopy is performed to assess the airway and identify any injuries. Surgical repair or stenting may be required for severe injuries that compromise airway integrity. Question: what is the role of hypertonic saline and dextran, HSD, in fluid resuscitation for trauma patients? Answer: hypertonic saline and dextran, HSD, solution is used in fluid resuscitation to expand intravascular volume and improve tissue perfusion. It provides both volume expansion and osmotic effects that help maintain blood pressure and prevent tissue edema. Question: describe the management of a patient with a suspected traumatic liver injury. Answer: in a patient with a suspected traumatic liver injury, hemodynamic stability is a priority. Imaging studies, such as CT scan, assess the extent of injury. Non-operative management is preferred for stable patients with minor injuries, while surgical intervention may be necessary for severe bleeding or hemodynamic instability.
Question: what is the significance of hemopneumothorax in trauma assessment? Answer: hemopneumothorax refers to the presence of both blood and air in the pleural space, often resulting from trauma or chest injuries. It can lead to lung collapse, respiratory distress, and decreased oxygenation. Immediate chest tube insertion is needed to evacuate blood and air and restore lung function. Question: discuss the management of a patient with a suspected traumatic carotid artery injury. Answer: in a patient with a suspected traumatic carotid artery injury, immediate hemodynamic stabilization and vascular surgery consultation are essential. Diagnostic angiography or imaging studies assess the extent of injury, and surgical repair may be required to prevent stroke or hemorrhage. Question: explain the concept of tourniquet use in trauma management. Answer: a tourniquet is a device used to control severe bleeding from extremity injuries in trauma patients. When applied correctly and promptly, it can prevent exsanguination and save lives. Tourniquets should be released after bleeding control, and the duration of use should be minimized to prevent tissue damage. Question: describe the management approach for a patient with suspected traumatic bladder rupture. Answer: in a patient with suspected traumatic bladder rupture, surgical exploration and repair are essential to prevent urinary leakage, infection, and subsequent complications. Foley catheter placement may be performed after surgical repair to ensure proper drainage. Question: what is the role of damage control abdominal surgery in trauma patients? Answer: damage control abdominal surgery involves limited surgical interventions to control bleeding, repair injuries, and prevent contamination in critically ill trauma patients. Definitive repair is delayed until the patient's condition stabilizes. This approach reduces surgical stress and optimizes patient outcomes.
Question: discuss the management of a patient with a suspected traumatic renal artery injury. Answer: in a patient with a suspected traumatic renal artery injury, immediate hemodynamic stabilization and vascular surgery consultation are crucial. Angiography or imaging studies assess the extent of injury, and surgical repair or embolization may be required to prevent renal dysfunction. Question: explain the concept of perioperative hypothermia in trauma patients. Answer: perioperative hypothermia refers to a drop in body temperature during surgery. In trauma patients, it can exacerbate coagulopathy, increase infection risk, and impact patient outcomes. Measures such as warming blankets, fluid warming, and warmed intravenous fluids are used to prevent perioperative hypothermia. Question: describe the management approach for a patient with suspected traumatic thoracic aortic injury. Answer: in a patient with suspected traumatic thoracic aortic injury, immediate hemodynamic stabilization is crucial. Imaging studies, such as cord angiography, assess the extent of injury. Definitive surgical repair or endovascular stent grafting is required to prevent further complications. Question: discuss the indications and technique for using a pericardial window in trauma patients. Answer: a pericardial window is indicated in trauma patients with suspected pericardial tamponade. It involves creating a controlled communication between the pericardial sac and the pleural space to drain accumulated fluid and relieve cardiac compression. Question: explain the role of angioembolization in traumatic liver injuries. Answer: angioembolization is a minimally invasive procedure used to treat traumatic liver injuries by blocking blood vessels that supply the injured area. It helps control bleeding, promotes hemostasis, and reduces the need for open surgery.
Question: describe the management of a patient with a suspected traumatic retrobulbar hematoma. Answer: in a patient with a suspected traumatic retrobulbar hematoma, immediate ophthalmologic consultation and potential surgical intervention are necessary to prevent vision loss and relieve pressure on the optic nerve. Question: what is the purpose of using a central venous oxygen saturation (SCVO2) monitor in trauma patients? Answer: central venous oxygen saturation (SCVO2) monitoring in trauma patients provides information about tissue oxygen delivery and consumption. It helps guide resuscitation efforts and assess the adequacy of oxygen supply to tissues. Question: discuss the management of a patient with a suspected traumatic pneumomediastinum. Answer: in a patient with suspected traumatic pneumomediastinum, air accumulation within the mediastinum, close observation and imaging studies are performed to assess the extent and cause of the condition. Supportive care and pain management are often sufficient for resolution. Question: explain the concept of autotransfusion in trauma patients. Answer: autotransfusion involves collecting and reinfusing a patient's own blood, often retrieved from surgical sites or internal bleeding, in trauma patients. It can help reduce the need for allogeneic blood transfusions and associated risks. Question: describe the management approach for a patient with a suspected traumatic diaphragmatic injury. Answer: in a patient with suspected traumatic diaphragmatic injury, imaging studies such as chest X-ray or CT scan are performed to assess diaphragmatic integrity. Surgical repair is required for severe injuries to prevent herniation, compromise of respiratory function, and other complications.
Question: discuss the management of a patient with a suspected traumatic urethral stricture. Answer: in a patient with suspected traumatic urethral stricture, urological consultation, urethral dilation, or surgical reconstruction may be considered depending on the severity of the stricture and associated symptoms. Question: what is the role of transarterial embolization in traumatic pelvic fractures? Answer: transarterial embolization is a procedure used to control bleeding in traumatic pelvic fractures by blocking blood vessels supplying the injured area. It helps stabilize the pelvis, control hemorrhage, and improve outcomes. Question: explain the concept of zonular cataract and its management in trauma patients. Answer: zonular cataract is a type of cataract caused by disruption of the zonulae that support the lens in the eye. In trauma patients, management may involve ophthalmologic consultation and potential surgical intervention to remove the cataract and restore vision. Question: discuss the management of a patient with a suspected traumatic abdominal aortic injury. Answer: in a patient with suspected traumatic abdominal aortic injury, immediate hemodynamic stabilization and vascular surgery consultation are crucial. Imaging studies assess the extent of injury, and surgical repair or endovascular intervention may be required to prevent catastrophic hemorrhage. Question: describe the management approach for a patient with suspected traumatic spinal subdural hematoma. Answer: in a patient with suspected traumatic spinal subdural hematoma, immediate neurosurgical consultation and imaging studies, such as MRI, are essential to confirm the diagnosis and assess the extent of bleeding. Surgical evacuation may be required to prevent spinal cord compression.
Question. What is the significance of battle sign and raccoon eyes in trauma assessment? Answer. Battle sign refers to bruising behind the ear and raccoon eyes refer to periorbital bruising. Both are indicative of basilar skull fracture or head trauma. Their presence alerts healthcare providers to potential skull and brain injuries, prompting further evaluation and monitoring. Question. Discuss the management of a patient with a suspected traumatic axillary artery injury. Answer. In a patient with suspected traumatic axillary artery injury, immediate hemodynamic stabilization and vascular surgery consultation are essential. Diagnostic angiography or imaging studies assess the extent of injury, and surgical repair or endovascular intervention may be required to restore vascular integrity. Question. Explain the concept of retained hemothorax in trauma patients. Answer. Retained hemothorax refers to the persistence of blood within the pleural space after chest tube placement or drainage in trauma patients. It can lead to infection, fibrosis, and respiratory compromise. Additional interventions, such as thoracoscopic surgery, may be required to evacuate the retained blood. Question. Describe the management approach for a patient with suspected traumatic retroperitoneal hemorrhage. Answer. In a patient with suspected traumatic retroperitoneal hemorrhage, imaging studies such as CT scan are performed to assess the extent of bleeding. Non-operative management is often favored for stable patients with minor hematomas, while surgical intervention may be required for significant bleeding or hemodynamic instability.
Question. What is the role of transthoracic echocardiography (TTE) in trauma patients? Answer. Transthoracic echocardiography (TTE) is used in trauma patients to assess cardiac function, identify pericardial tamponade, and detect other structural abnormalities. It provides real-time imaging of the heart, guiding interventions and treatment decisions. Question. Discuss the management of a patient with a suspected traumatic abdominal compartment syndrome. Answer. In a patient with suspected traumatic abdominal compartment syndrome, immediate surgical decompression is crucial to relieve pressure within the abdominal cavity. This prevents organ dysfunction, restores normal perfusion, and improves patient outcomes. Question. Explain the concept of secondary blast injury in trauma patients. Answer. Secondary blast injury refers to injuries caused by flying debris, fragments, or shrapnel generated by an initial explosion. These injuries can include penetrating wounds, fractures, and soft tissue damage. They are important considerations in the assessment and management of trauma patients in blast incidents. Question. Describe the management approach for a patient with suspected traumatic anterior urethral injury. Answer. In a patient with suspected traumatic anterior urethral injury, retrograde urethroplasty is performed to assess the urethra. Surgical repair or urethral stenting may be required for severe injuries that compromise urinary function.
Question. Discuss the management of a patient with a suspected traumatic intra-abdominal injury. Answer. In a patient with a suspected traumatic intra-abdominal injury, imaging studies such as FAST, ultrasound or CT scan are performed to assess for internal bleeding and organ damage. Non-operative management, observation, or surgical intervention may be chosen based on the severity of the injury. Question. Explain the concept of myocardial contusion in trauma patients. Answer. Myocardial contusion refers to bruising or injury to the heart muscle caused by blunt trauma, such as motor vehicle collisions. It can lead to cardiac arrhythmias, myocardial dysfunction, and other cardiovascular complications. ECG monitoring, echocardiography, and observation are important in assessing and managing myocardial contusion. Question. Describe the management approach for a patient with suspected traumatic lumbar spine fracture. Answer. In a patient with suspected traumatic lumbar spine fracture, spinal immobilization is maintained, and imaging studies, such as X-rays or CT scan, are performed to assess the extent of injury, supportive care, pain management, and addressing associated injuries are important aspects of management. Question. What is the role of whole-body computed tomography (WBCT) in trauma evaluation?
Answer: whole body computed. Tomography, WBCT, is a comprehensive imaging approach used in trauma evaluation to assess for multiple injuries simultaneously. It helps detect injuries to the head, neck, chest, abdomen, and pelvis, allowing for timely and accurate diagnosis and treatment.
Question. Discuss the management of a patient with a suspected traumatic retroperitoneal abscess. Answer. In a patient with suspected traumatic retroperitoneal abscess, imaging studies such as CT scan are performed to assess the extent of infection. Antibiotic therapy and surgical drainage may be required to treat the abscess and prevent sepsis. Question. Explain the concept of iatrogenic trauma and its implications in patient care. Answer. Iatrogenic trauma refers to injuries or harm caused inadvertently by medical interventions, procedures, or treatments. It emphasizes the importance of vigilant patient assessment, communication, and adherence to established protocols to minimize the risk of complications during medical care. Question. Describe the management approach for a patient with suspected traumatic bowel perforation. Answer. In a patient with suspected traumatic bowel perforation, immediate surgical exploration and repair are essential to prevent peritonitis, sepsis, and other complications. Antibiotic therapy and supportive care are important aspects of management. Question. Discuss the management of a patient with a suspected traumatic vertebral artery injury. Answer. In a patient with suspected traumatic vertebral artery injury, immediate neurovascular consultation and imaging studies, such as angiography, are essential to assess the extent of injury. Endovascular intervention or surgical repair may be required to prevent stroke or hemorrhage.
Question. Explain the concept of cervical spine clearance in trauma assessment. Answer. Cervical spine clearance refers to determining whether a trauma patient has sustained cervical spine injuries or fractures. It involves clinical evaluation, imaging studies, and guidelines to safely clear the cervical spine for movement or procedures, while ensuring patient safety. Question. Describe the management approach for a patient with suspected traumatic diaphragmatic hernia. Answer. In a patient with suspected traumatic diaphragmatic hernia, imaging studies such as chest X-ray or CT scan are performed to assess diaphragmatic integrity and herniation. Surgical repair is required to prevent organ strangulation and respiratory compromise. Question. Discuss the management of a patient with a suspected traumatic retroperitoneal hematoma. Answer. In a patient with suspected traumatic retroperitoneal hematoma, imaging studies such as CT scan are performed to assess the extent of bleeding. Non-operative management is often favored for stable patients with minor hematomas, while surgical intervention may be required for significant bleeding or hemodynamic instability. Question. Explain the concept of pneumothorax and its management in trauma patients. Answer. Pneumothorax is the presence of air in the pleural space, leading to lung collapse. Management involves chest tube insertion to evacuate air, restore lung expansion, and prevent complications such as tension pneumothorax and respiratory distress.
Question. How are burn scars managed? Answer. Burn scar management includes scar massage, pressure garments, and potential surgical interventions to improve scar appearance and function. Question. What is the significance of grafting in burn injuries? Answer. Skin grafting helps cover burn wounds, promote healing, and improve function by replacing damaged skin with healthy tissue. Question. How are donor sites managed in burn grafting? Answer. Donor sites require wound care, pain management, and monitoring for complications after grafting procedures. Question. What is the role of physical therapy in burn injury rehabilitation? Answer. Physical therapy focuses on maintaining joint mobility, preventing contractures, and improving functional outcomes in burn injury patients. Question. How are pressure ulcers managed in burn patients? Answer. Preventing pressure ulcers involves regular repositioning, proper cushioning, and addressing risk factors in burn patients with reduced mobility. Question. How are burn injuries managed in elderly patients? Answer. Managing burn injuries in the elderly involves considering skin fragility, comorbidities, and potential complications. Question. What is the significance of burn wound infections? Answer: burn wound infections can lead to sepsis and delay healing. Early diagnosis, wound cultures, and appropriate antibiotic therapy are essential. Question: how are burn injuries managed in patients with compromised immune systems? Answer: patients with compromised immune systems require careful wound care, infection prevention, and potential collaboration with specialists. Question: what is the role of pain management in burn injury patients? Answer: effective pain management involves a multimodal approach that addresses both acute and chronic pain in burn injury patients. Question: how are electrical burns managed? Answer: electrical burns require careful assessment for internal injuries, wound care, and potential surgical intervention. Question: what is the role of wound care in burn injury management? Answer: proper wound care, including debridement, dressing changes, and infection prevention, is essential for successful burn injury healing. Question: how are burn injuries managed in the acute phase? Answer: management involves wound care, pain control, fluid resuscitation, infection prevention, and addressing potential complications. Question: what is the significance of escherotomies in burn injuries? Answer: escherotomies involve incisions through burn tissue to relieve pressure, prevent circulation impairment, and maintain tissue viability. Question: how are burn injuries managed in pediatric patients? Answer: pediatric burn injuries require specialized management that accounts for growth, development, and psychosocial considerations. Question: what is the role of nutritional support in burn injury management? Answer: adequate nutrition supports wound healing, immune function, and overall recovery in burn injury patients. Question: what is the role of fluid resuscitation in managing burn injuries? Answer: fluid resuscitation is crucial to maintain adequate circulation and prevent complications like hypovolemic shock in burn patients. Question: how are chemical burns managed? Answer: chemical burns require immediate removal of the offending agent, followed by thorough irrigation and wound care. Question: what is the significance of inhalation injuries in burn patients? Answer: inhalation injuries can lead to airway compromise and respiratory distress in burn patients, requiring prompt assessment and intervention.
Question: how are upper limb injuries managed in patients with chronic pain conditions? Answer: managing upper limb injuries in patients with chronic pain involves a multidisciplinary approach that addresses both the acute injury and chronic pain management. Question: what is the role of upper limb prosthetics in severe upper limb injuries? Answer: upper limb prosthetics play a crucial role in restoring function and quality of life in patients with amputations or severe upper limb injuries. Question: how are upper limb injuries managed in patients with peripheral artery disease, PAD? Answer: patients with PAD require careful assessment and vascular evaluation to determine appropriate treatment strategies for upper limb injuries. Question: what is the significance of upper limb injuries in geriatric patients? Answer: upper limb injuries in geriatric patients require tailored management that considers factors such as bone health, functional status, and potential surgical risks. Question: what are the different degrees of burn injuries? Answer: burn injuries are classified into 3 degrees. First-degree burns involve the outermost layer of skin, second-degree burns affect deeper layers, and third-degree burns penetrate all layers of skin. Question: what is the significance of assessing burn injury depth? Answer: assessing burn injury depth guides treatment decisions and predicts the likelihood of scarring and functional impairment. Question: how are burn injuries classified? Based on extent? Answer: burn injuries are classified based on the rule of Nines or Lund and Browder chart to determine the percentage of total body surface area affected.
Question: how are upper limb injuries managed in patients with systemic diseases like diabetes? Answer: managing upper limb injuries in patients with diabetes involves careful wound care, glycemic control, and potential collaboration with specialists. Question: what is the significance of upper limb injuries in polytrauma patients? Answer: Upper limb injuries in polytrauma cases must be evaluated and managed alongside other injuries, considering overall patient stability and priorities. Question: how are upper limb fractures managed in patients with osteoporosis? Answer: managing upper limb fractures in patients with osteoporosis involves stabilizing fractures while considering the fragility of bones. Question: what is the significance of upper limb injuries in military or combat scenarios? Answer: upper limb injuries in military settings require rapid assessment, stabilization, and evacuation to provide optimal care and preserve function. Question: how are upper limb injuries managed in patients with autoimmune disorders? Answer: managing upper limb injuries in patients with autoimmune disorders involves addressing underlying immune-related issues while providing appropriate treatment. Question: what is the role of imaging-guided interventions in upper limb injury management? Answer: interventions such as nerve blocks or injections guided by imaging can provide diagnostic information and targeted pain relief in upper limb injuries. Question: how are upper limb fractures managed in patients with previous orthopedic hardware? Answer: managing upper limb fractures in patients with previous hardware requires careful planning to ensure stability and minimize complications. Question: what is the significance of upper limb injuries in industrial or workplace accidents? Answer: upper limb injuries in workplace settings often require comprehensive evaluation, treatment, and may involve legal considerations.
Question: how are upper limb injuries managed in the elderly population? Answer: managing upper limb injuries in the elderly involves considering bone density, frailty, and functional goals in treatment decisions. Question: what is the role of regenerative therapies in upper limb injury management? Answer: regenerative therapies, such as platelet-rich plasma, PRP, injections, may aid in tissue healing and promote recovery in upper limb injuries. Question: how are upper limb injuries managed in pediatric patients? Answer: pediatric upper limb injuries require careful evaluation, immobilization, and monitoring to ensure proper growth and function. Question: what is the significance of brachial plexus injuries in upper limb trauma? Answer: brachial plexus injuries can lead to motor and sensory deficits in the upper limb, requiring accurate diagnosis and often surgical intervention. Question: how are upper limb injuries managed in pregnant women? Answer: management involves considering both the safety of the mother and the fetus, balancing treatment options and rehabilitation. Question: what is the role of occupational therapy in upper limb injury rehabilitation? Answer: occupational therapy focuses on improving activities of daily living and functional independence in individuals with upper limb injuries. Question: how are upper limb nerve injuries repaired? Answer: nerve repair may involve direct suturing, nerve grafting, or nerve transfers, depending on the severity and location of the injury. Question: what is the significance of upper limb vascular injuries? Answer: upper limb vascular injuries can lead to compromised blood flow, tissue ischemia, and require prompt surgical intervention to restore circulation.
Question: how are wrist fractures managed? Answer: management involves immobilization, closed reduction, and, in certain cases, surgical fixation to optimize wrist function and stability. Question: what is the role of hand therapy in upper limb injury rehabilitation? Answer: hand therapy focuses on improving hand and finger function, fine motor skills, and activities of daily living after upper limb injuries. Question: how are finger fractures and dislocations managed? Answer: management includes splinting, body taping, or surgical intervention, depending on the severity and stability of the injury. Question: what is the significance of mallet finger injuries? Answer: mallet finger injuries involve extensor tendon avulsion, leading to the inability to extend the distal finger joint. Treatment involves splinting and rehabilitation. Question: how are open fractures of the upper limb managed? Answer: Open fractures require urgent wound care, administration of antibiotics, and surgical debridement to prevent infection and promote healing. Question: what is the role of imaging in upper limb injury assessment? Answer: X-rays, CT scans, and MRIs help visualize fractures, dislocations, ligament injuries, and soft tissue abnormalities in the upper limb. Question: how are upper limb injuries managed in athletes? Answer: athletes require specialized management that aims to restore function, prevent re-injury, and facilitate a safe return to sports. Question: what is the significance of thoracic outlet syndrome in upper limb trauma? Answer: thoracic outlet syndrome involves compression of nerves or blood vessels between the collarbone and first rib, leading to pain and neurological symptoms in the upper limb.
Question: what is the role of immobilization in upper limb fractures? Answer: immobilization with splints or casts helps stabilize fractures, prevent further injury, and promote proper healing. Question: how are upper limb dislocations managed? Answer: reduction of the dislocation, immobilization, pain management, and rehabilitation are key components of managing upper limb dislocations. Question: what is the significance of rotator cuff injuries? Answer: rotator cuff injuries can result in shoulder pain, weakness, and limited range of motion, requiring comprehensive assessment and rehabilitation. Question: how are fractures of the humerus managed? Answer: management depends on the location and severity of the fracture, ranging from non-operative treatment to surgical intervention. Question: what is the role of physical therapy in upper limb injury rehabilitation? Answer: physical therapy focuses on restoring strength, range of motion, and function in the upper limb after injury or surgery. Question: what is the significance of nerve injuries in upper limb trauma? Answer: nerve injuries can lead to sensory deficits, muscle weakness, and impaired function in the upper limb, necessitating prompt evaluation and potential surgical intervention. Question: how are fractures of the radius and ulna managed? Answer: treatment ranges from closed reduction and casting to surgical fixation, depending on the type and stability of the fracture. Question: what is the significance of compartment syndrome in forearm injuries? Answer: compartment syndrome involves increased pressure within a muscle compartment, potentially leading to tissue damage and requiring urgent intervention.
Question: explain the concept of pre-hospital communication with infection control teams in trauma care. Answer: pre-hospital communication with infection control teams involves addressing infection risk and proper prevention strategies during the care of trauma patients. Effective communication ensures adherence to infection control protocols. Question: describe the management approach for a patient with suspected traumatic knee meniscus injury. Answer: in a patient with suspected traumatic knee meniscus injury, clinical evaluation, imaging studies such as MRI, and potential surgical intervention or conservative management are necessary based on the extent of meniscal damage. Question: discuss the management of a patient with a suspected traumatic myocardial infarction. Answer: in a patient with suspected traumatic myocardial infarction, clinical evaluation, electrocardiogram monitoring, and appropriate interventions to restore blood flow and prevent cardiac complications are necessary. Question: explain the concept of pre-hospital communication with infection control teams in trauma care. Answer: pre-hospital communication with infection control teams involves addressing infection risk and proper prevention strategies during the care of trauma patients. Effective communication ensures adherence to infection control protocols. Question: describe the management approach for a patient with suspected traumatic knee collateral ligament injury. Answer: in a patient with suspected traumatic knee collateral ligament injury, clinical evaluation, imaging studies such as MRI, and potential surgical intervention or conservative management are necessary based on the severity of the injury.
Question: discuss the management of a patient with a suspected traumatic myocardial contusion. Answer: in a patient with suspected traumatic myocardial contusion, clinical evaluation, imaging studies such as echocardiography, and cardiac enzyme monitoring are performed to assess cardiac function and injury. Supportive care and monitoring are important for cardiac recovery. Question: explain the concept of pre-hospital communication with disaster response teams in trauma care. Answer. Pre-hospital communication with disaster response teams involves coordination and cooperation during large-scale emergencies. Effective communication ensures efficient allocation of resources and optimal patient care in challenging situations. Question. Describe the management approach for a patient with suspected traumatic ankle dislocation. Answer. In a patient with suspected traumatic ankle dislocation, clinical evaluation, imaging studies such as X-rays or CT scan, and prompt reduction are necessary to restore joint alignment and assess associated injuries. Question. Discuss the management of a patient with a suspected traumatic vertebral compression fracture. Answer. In a patient with suspected traumatic vertebral compression fracture, imaging studies such as X-rays or MRI, and potential non-operative management or surgical intervention are necessary based on the extent of vertebral damage. Question. Explain the concept of pre-hospital communication with social services in trauma care. Answer. Pre-hospital communication with social services involves addressing the psychosocial needs of trauma patients, including those related to domestic violence, substance abuse, or other social factors. Effective communication ensures proper support and resources for vulnerable patients.
On T. Question. Discuss the management of a patient with a suspected traumatic spinal cord injury. Answer. In a patient with suspected traumatic spinal cord injury, clinical assessment, imaging studies, such as CT scan or MRI, and proper spinal immobilization are necessary. Supportive care, potential surgical intervention, and rehabilitation play key roles in recovery. Question. Explain the concept of pre-hospital communication with infectious disease specialists in trauma care. Answer. Pre-hospital communication with infectious disease specialists involves addressing potential infection risks and optimizing prevention strategies during the care of trauma patients. Effective communication helps prevent infectious complications. Question. Describe the management approach for a patient with suspected traumatic ankle ligament injury. Answer. In a patient with suspected traumatic ankle ligament injury, clinical evaluation, imaging studies, such as MRI, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage. Question. Discuss the management of a patient with a suspected traumatic spinal epidural hematoma. Answer. In a patient with suspected traumatic spinal epidural hematoma, imaging studies such as MRI or CT scan and surgical intervention for decompression and hematoma evacuation may be necessary to relieve spinal cord compression.
Question. Explain the concept of pre-hospital communication with psychiatrists in trauma care. Answer. Pre-hospital communication with psychiatrists involves addressing the mental health needs of trauma patients, including those related to acute stress, anxiety, or other psychological factors. Effective communication ensures proper support and resources for emotional well-being. Question. Describe the management approach for a patient with suspected traumatic ankle syndesmosis injury. Answer. In a patient with suspected traumatic ankle syndesmosis injury, clinical evaluation, imaging studies such as MRI, and potential non-operative management or surgical intervention are necessary based on the severity of the injury. Question. Discuss the management of a patient with a suspected traumatic spinal subluxation. Answer. In a patient with suspected traumatic spinal subluxation, clinical assessment, imaging studies, such as X-rays or MRI, and potential non-operative management or surgical intervention are necessary based on the extent of vertebral misalignment. Question. Explain the concept of pre-hospital communication with pediatricians in trauma care. Answer. Pre-hospital communication with pediatricians involves conveying critical patient information and addressing the unique medical needs of pediatric trauma patients. Effective communication ensures proper care and resources for injured children.
Question: describe the management approach for a patient with suspected traumatic wrist dislocation. Answer: in a patient with suspected traumatic wrist dislocation, clinical evaluation, imaging studies, such as X-rays or CT scan, and prompt reduction are necessary to restore joint alignment and assess associated injuries. Question: discuss the management of a patient with a suspected traumatic spinal cord contusion. Answer: in a patient with suspected traumatic spinal cord contusion, clinical assessment, imaging studies, such as CT scan or MRI, and potential non-operative management or surgical intervention are necessary. Supportive care and rehabilitation are crucial for functional recovery. Question: explain the concept of pre-hospital communication with plastic surgeons in trauma care. Answer: pre-hospital communication with plastic surgeons involves addressing complex soft tissue injuries and potential reconstructive needs of trauma patients. Effective communication ensures proper wound management and restoration of function and appearance. Question: describe the management approach for a patient with suspected traumatic wrist fracture. Answer: in a patient with suspected traumatic wrist fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management or surgical intervention may be chosen based on the fracture type and stability.
Question: discuss the management of a patient with a suspected traumatic spinal burst fracture. Answer: in a patient with suspected traumatic spinal burst fracture, clinical assessment, imaging studies, such as X-rays or MRI, and potential non-operative management or surgical intervention are necessary based on the extent of vertebral damage and neurological involvement. Question: explain the concept of pre-hospital communication with anesthesiologists in trauma care. Answer: pre-hospital communication with anesthesiologists involves addressing potential anesthetic needs and challenges during the care of trauma patients. Effective communication ensures appropriate pain management and procedural sedation. Question: describe the management approach for a patient with suspected traumatic wrist ligament injury. Answer: in a patient with suspected traumatic wrist ligament injury, clinical evaluation, imaging studies, such as MRI, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage. Question: discuss the management of a patient with a suspected traumatic spinal ligament injury. Answer: in a patient with suspected traumatic spinal ligament injury, clinical assessment, imaging studies such as MRI or CT scan, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage and spinal stability.
Question: explain the concept of pre-hospital communication with occupational therapists in trauma care. Answer: pre-hospital communication with occupational therapists involves addressing the functional needs and rehabilitation goals of trauma patients. Effective communication ensures proper planning for post-acute care and restoration of daily activities. Question: describe the management approach for a patient with suspected traumatic wrist scaphoid fracture. Answer: in a patient with suspected traumatic wrist scaphoid fracture, imaging studies such as X-rays or MRI are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic spinal nerve injury. Answer: in a patient with Suspected traumatic spinal nerve injury, clinical assessment, imaging studies, such as MRI, and potential surgical intervention or conservative management are necessary based on the extent of nerve damage and neurological deficit. Question: explain the concept of pre-hospital communication with physical therapists in trauma care. Answer: pre-hospital communication with physical therapists involves addressing the mobility and physical therapy needs of trauma patients. Effective communication ensures proper planning for post-acute care and restoration of functional movement.
Question: describe the management approach for a patient with suspected traumatic wrist tendon injury. Answer: in a patient with suspected traumatic wrist tendon injury, clinical evaluation, imaging studies, such as MRI, and potential non-operative management or surgical intervention, are necessary based on the extent of tendon damage and functional impairment. Question: discuss the management of a patient with a suspected traumatic spinal fracture dislocation. Answer: in a patient with suspected traumatic spinal fracture dislocation, clinical assessment, imaging, studies such as X-rays or MRI, and potential surgical intervention or non-operative management are necessary based on the extent of vertebral damage and spinal instability. Question: describe the management approach for a patient with suspected traumatic wrist cartilage injury. Answer: in a patient with suspected traumatic wrist cartilage injury, clinical evaluation, imaging, studies such as MRI, and potential non-operative management or surgical intervention, such as arthroscopy, are necessary based on the extent of cartilage damage and functional impairment. Question: discuss the management of a patient with a suspected traumatic thoracic spine fracture. Answer: in a patient with suspected traumatic thoracic spine fracture, clinical assessment, imaging, studies such as X-rays or MRI, and potential surgical intervention or non-operative management are necessary based on the extent of vertebral damage and spinal stability.
Question: discuss the management of a patient with a suspected traumatic cervical spine fracture. Answer: in a patient with suspected traumatic cervical spine fracture, clinical assessment, imaging studies such as X-rays or MRI, and potential surgical intervention or non-operative management are necessary based on the extent of vertebral damage and spinal stability. Question: explain the concept of pre-hospital communication with orthopedic surgeons in trauma care. Answer: pre-hospital communication with orthopedic surgeons involves addressing potential fractures and musculoskeletal injuries of trauma patients. Effective communication ensures proper assessment, stabilization, and management of orthopedic injuries. Question: describe the management approach for a patient with suspected traumatic wrist ganglion cyst. Answer: in a patient with suspected traumatic wrist ganglion cyst, clinical evaluation, imaging studies such as MRI, and potential non-operative management or surgical intervention are necessary based on the size and symptoms of the cyst. Question: discuss the management of a patient with a suspected traumatic cervical spinal cord injury. Answer: in a patient with suspected traumatic cervical spinal cord injury, clinical assessment, imaging studies such as X-rays or MRI, and potential surgical intervention or non-operative management are necessary based on the extent of spinal cord damage and neurological deficits.
Question: explain the concept of pre-hospital communication with respiratory therapists in trauma care. Answer: pre-hospital communication with respiratory therapists involves addressing potential respiratory complications and needs of trauma patients. Effective communication ensures proper airway management and respiratory support. Question: describe the management approach for a patient with suspected traumatic elbow dislocation. Answer: in a patient with suspected traumatic elbow dislocation, clinical evaluation, imaging studies, such as X-rays or CT scan, and prompt reduction are necessary to restore joint alignment and assess associated injuries. Question: discuss the Management of a patient with a suspected traumatic cervical ligament injury. Answer: in a patient with suspected traumatic cervical ligament injury, clinical assessment, imaging. Studies such as MRI or CT scan, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage and spinal stability. Question: explain the concept of pre-hospital communication with vascular surgeons in trauma care. Answer: pre-hospital communication with vascular surgeons involves addressing potential vascular injuries and hemorrhage control in trauma patients. Effective communication ensures prompt assessment and intervention to prevent life-threatening bleeding.
Question: describe the management approach for a patient with suspected traumatic elbow fracture. Answer: in a patient with suspected traumatic elbow fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic cervical spinal nerve injury. Answer: in a patient with suspected traumatic cervical spinal nerve injury, clinical assessment, imaging studies such as MRI, and potential surgical intervention or conservative management are necessary based on the extent of nerve damage and neurological deficit. Question: explain the concept of pre-hospital communication with trauma psychologists in trauma care. Answer: pre-hospital communication with trauma psychologists involves addressing potential psychological distress and needs of trauma patients. Effective communication ensures proper support and resources for emotional well-being and coping. Question: describe the management approach for a patient with suspected traumatic elbow ligament injury. Answer: in a patient with suspected traumatic elbow ligament injury, clinical evaluation, imaging studies such as MRI, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage and functional impairment.
Question: discuss the management of a patient with a suspected traumatic thoracic aortic injury. Answer: in a patient with suspected traumatic thoracic aortic injury, clinical evaluation, imaging studies such as CT scan or angiography, and surgical intervention are necessary to prevent fatal complications and address aortic integrity. Question: explain the concept of pre-hospital communication with trauma nurses in trauma care. Answer: pre-hospital communication with trauma nurses involves addressing the immediate nursing needs and interventions for trauma patients. Effective communication ensures proper assessment, stabilization, and initial management. Question: describe the management approach for a patient with suspected traumatic elbow cartilage injury. Answer: in a patient with suspected traumatic elbow cartilage injury, clinical evaluation, imaging studies such as MRI, and potential non-operative management or surgical intervention, such as arthroscopy, are necessary based on the extent of cartilage damage and functional impairment. Question: discuss the management of a patient with a suspected traumatic abdominal aortic injury. Answer: in a patient with suspected traumatic abdominal aortic injury, clinical evaluation, imaging studies such as CT scan or angiography, and surgical intervention are necessary to prevent fatal complications and address aortic integrity.
Question: discuss the management of a patient with a suspected traumatic abdominal diaphragmatic injury. Answer: in a patient with suspected traumatic abdominal diaphragmatic injury, imaging studies such as chest X-ray or CT scan are performed to assess diaphragmatic integrity and potential herniation. Surgical repair is required to prevent organ strangulation and respiratory compromise. Question: explain the concept of pre-hospital communication with trauma speech therapists in trauma care. Answer: pre-hospital communication with trauma speech therapists involves addressing potential communication and swallowing difficulties of trauma patients. Effective communication ensures proper evaluation and support for speech and swallowing rehabilitation. Question: describe the management approach for a patient with suspected traumatic finger ligament injury. Answer: in a patient with suspected traumatic finger ligament injury, clinical evaluation, imaging studies such as X-rays, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage and functional impairment. Question: Discuss the management of a patient with a suspected traumatic abdominal retroperitoneal injury. Answer. In a patient with suspected traumatic abdominal retroperitoneal injury, imaging studies such as CT scan are performed to assess the extent of injury and potential bleeding. Non-operative management, embolization, or surgical intervention may be required to control bleeding and prevent complications.
Question. Explain the concept of pre-hospital communication with trauma chaplains in trauma care. Answer. Pre-hospital communication with trauma chaplains involves addressing the spiritual and emotional needs of trauma patients and their families. Effective communication ensures appropriate support and resources for emotional well-being and coping. Question. Describe the management approach for a patient with suspected traumatic finger extensor tendon injury. Answer. In a patient with suspected traumatic finger extensor tendon injury, clinical evaluation, imaging studies such as ultrasound, and potential non-operative management or surgical intervention are necessary based on the extent of tendon damage and functional impairment. Question. Discuss the management of a patient with a suspected traumatic abdominal vascular injury. Answer. In a patient with suspected traumatic abdominal vascular injury, clinical evaluation, imaging studies such as CT scan or angiography, and surgical intervention are necessary to prevent fatal complications and address vascular integrity. Question. Explain the concept of pre-hospital communication with trauma interpreters in trauma care. Answer. Pre-hospital communication with trauma interpreters involves addressing language and communication barriers for non-English speaking trauma patients. Effective communication ensures accurate understanding and provision of care.
Question. Discuss the management of a patient with a suspected traumatic abdominal hollow organ perforation. Answer. In a patient with suspected traumatic abdominal hollow organ perforation, imaging studies such as CT scan are performed to assess the extent of injury and potential leakage. Surgical repair or conservative management may be required based on the type and severity of perforation. Question. Explain the concept of pre-hospital communication with trauma dietitians in trauma care. Answer. Pre-hospital communication with trauma dietitians involves addressing nutritional needs and requirements for optimal recovery and healing of trauma patients. Effective communication ensures proper nutritional support and planning. Question. Describe the management approach for a patient with suspected traumatic toe fracture. Answer. In a patient with suspected traumatic toe fracture, imaging studies such as X-rays are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question. Discuss the management of a patient with a suspected traumatic abdominal solid organ perforation. Answer. In a patient with suspected traumatic abdominal solid organ perforation, imaging studies such as CT scan are performed to assess the extent of injury and potential leakage. Surgical repair or conservative management may be required based on the type and severity of perforation.
Question. Explain the concept of pre-hospital communication with trauma interpreters in trauma care. Answer. Pre-hospital communication with trauma interpreters involves addressing language and communication barriers for non-English speaking trauma patients. Effective communication ensures accurate understanding and provision of care. Question. Describe the management approach for a patient with suspected traumatic toe ligament injury. Answer. In a patient with suspected traumatic toe ligament injury, clinical evaluation, imaging studies such as ultrasound, and potential non-operative management or surgical intervention are necessary based on the extent of ligament damage and functional impairment. Question. Discuss the management of a patient with a suspected traumatic abdominal retroperitoneal hematoma. Answer. In a patient with suspected traumatic abdominal retroperitoneal hematoma, imaging studies such as CT scan are performed to assess the extent of bleeding and potential vascular injury. Non-operative management, embolization, or surgical intervention may be required to control bleeding and prevent complications. Question. Explain the concept of pre-hospital communication with trauma radiologists in trauma care. Answer. Pre-hospital communication with trauma radiologists involves addressing the imaging needs of trauma patients. Effective communication ensures accurate and timely interpretation of imaging studies to guide clinical decisions.
Question. Describe the management approach for a patient with suspected traumatic toe cartilage injury. Answer. In a patient with suspected traumatic toe cartilage injury, clinical evaluation, imaging studies such as ultrasound and potential non-operative management or surgical intervention, such as arthroscopy, are necessary based on the extent of cartilage damage and functional impairment. Question: discuss the management of a patient with a suspected traumatic abdominal diaphragmatic hernia. Answer: in a patient with suspected traumatic abdominal diaphragmatic hernia, imaging studies such as chest X-ray or CT scan are performed to assess diaphragmatic integrity and potential herniation. Surgical repair is required to prevent organ strangulation and respiratory compromise. Question: explain the concept of pre-hospital communication with trauma anesthetists in trauma care. Answer: pre-hospital communication with trauma anesthetists involves addressing potential anesthetic needs and challenges during the care of trauma patients. Effective communication ensures appropriate pain management and procedural sedation. Question: describe the management approach for a patient with suspected traumatic toe extensor tendon injury. Answer: in a patient with suspected traumatic toe extensor tendon injury, clinical evaluation, imaging studies such as ultrasound and potential non-operative management or surgical intervention are necessary based on the extent of tendon damage and functional impairment.